I'm an oncologist, a cancer doctor. That's me. And I'm always thinking about tobacco. It's not new or sexy or a groundbreaking issue, but tobacco is predicted to kill 1 billion people this century. And you probably have no idea that you are almost certainly part of the problem. I was too. In 2010, I had devoted myself to saving lives. Despite my best efforts and the best medical care, nearly all of my cancer patients died. It was quite something for a young doctor to witness firsthand the true impact of tobacco. Then one day, at the hospital cafeteria, one conversation changed everything. I was meeting with a representative from my pension fund, and I thought it was going to be the most boring meeting of my entire life. I mean, seriously, pensions, riveting stuff. But I was wrong. After reviewing my account balance, I asked him if I was meant to tell him what to do with my money. No, he said, it's all taken care of. You're invested in the default option. Option, I said. Does that mean there are other options, other ways to invest my money? He looked at me, rolled his eyes, and said, well, there is this one special option for people who have a problem with investing in mining, alcohol, or tobacco. I said, did you just say tobacco? He said, yes. I said, so are you telling me I'm currently investing in tobacco? And he said, oh yes, everyone is. I am a cancer doctor. Tobacco kills my patients. Yet I was investing in tobacco and I was making money with every cigarette sold. I knew right then I couldn't rest until the problem was fixed. Here is the scale of the challenge. Right now, 90% of the world's largest pension funds invest in tobacco. 95% of the world's largest banks do not have a policy stopping them from lending money to tobacco companies. And the vast majority of the world's insurance companies, companies that exist to insure life or insure health, invest money in tobacco companies at the same time. Here in India, 5 of the largest Indian insurance companies own 1/3 of ITC. That's the Indian Tobacco Company. But don't despair. Here in the audience today is Dr. Chaturvedi, a head and neck surgeon from Mumbai. There he is, give him a wave. A head and neck surgeon from Mumbai who is currently urging these very insurance companies to go tobacco-free. It's an issue that's gone all the way to the Bombay High Court. So why does he care so much about this? Why do I care so much about this? Why should you care? When you invest in a company, you own part of that company. You want that company to grow and succeed and thrive. And the company sells products and finds new customers to make you money. So what's holding all of this back? The number one concern of financial organisations when they consider rejecting tobacco is that if they stop investing in tobacco, they'll be forced to stop investing in a never-ending list of questionable or undesirable companies, like those in mining or fast food. But tobacco stands apart. 0 is the only safe number of cigarettes for human consumption. The impact of tobacco is so bad that it compelled world leaders to create the United Nations Tobacco Treaty, the only global health treaty that exists. And it's impossible to be a responsible investor in tobacco because the tobacco business is the problem. Secondly, and perhaps more importantly, what about tobacco farmers? Will this idea hurt farming families? On the contrary, farms that have converted to other crops, like herbs, spices, beans, are flourishing. Here in India, there are government incentives to help farmers transition. Lives are saved and people are fed. So, are you happy for your bank, your pension fund, or your insurer to invest your money in tobacco companies? Here are some tobacco numbers to help you answer that question. 19,178 people will die today because of tobacco. That's 7 million people this year. And 1 million of those deaths will be right here in India. In India, tobacco is responsible for 50% of all cancers, and the survival rates for many of them are dismal. If we take lung cancer, for example, just 10% of Indian patients are alive 5 years after diagnosis. When someone gets lung cancer, their risk of going bankrupt skyrockets to almost 4 times that of an average person. And while lung cancer patients are dying, or going bankrupt while they are dying, tobacco company executives just get richer. In 2016, the CEO of one of the world's largest tobacco companies was paid a salary of $27.6 million US. That's 175 crore rupees. Meanwhile, government health budgets are being drained. $1 trillion US, 63 lakh crore rupees is the annual cost of tobacco to the global community. Tobacco companies rack up the costs, but they don't pay for them. We do. And if we take the annual profit made by tobacco companies and divide it by the 7 million deaths caused, we have 7,142 US dollars or 450,000 rupees of profit they make on each and every death. That is the human price. And what about our future? Let's look at the impact of tobacco on children. Children might be little, but their tobacco numbers are not. Here in India, 2.5 million boys and girls smoke cigarettes every single day. In the USA, 1 in 13 children alive today is destined to die early because of tobacco. And there are at least 17 countries where child labour is relied upon for tobacco production, including in Malawi, Mozambique, Mexico, Brazil, and in Asia, in Indonesia, Cambodia, Vietnam, the Philippines, and right here in India. What happened to us as a global community to allow those numbers to exist? If a new product were invented today and caused those numbers, would we invest in it? No. The tobacco numbers are our numbers. We can't say, oh, that's a terrible problem, as if we're merely spectators and the problem's somewhere over there. If we invest in tobacco companies, the tobacco numbers belong to us. If we have a pension fund, a bank account, or take out insurance, the tobacco numbers are our numbers, and they will not just fix themselves. If I had one wish, it would be for everyone, everywhere, to understand that they have the power to help fix one of the greatest challenges of our time. Doctors, scientists, educators, and governments are using their skills to help combat tobacco, but we need your help. You might not see yourself as a health hero, but that's exactly who you could become. Ask your financial organisations to quit tobacco. Ask them. The movement has already begun. In the past 5 years, more than 80 leading financial organisations in 11 countries controlling trillions of dollars have gone tobacco-free. And in the process, they've shifted more than $12 billion away from investment in tobacco. Every investment you make shapes the world. We must ask ourselves, is investing in tobacco shaping the world we want? Thank you.